want to thank you for being here today. And I always give my all to anybody who's in the audience. And so I'm going to spend almost an hour with you, and hopefully we cover things that are important to you. And I'm also going to have some time at the end. If you have any questions, please don't hesitate to use me. I'm here for you, and I want to help you learn some things today and perhaps even teach you some more things that you can use in the future also. I want to say hello to the people on Zoom also. And the same thing goes for you. If you have any questions, you can jot them down and send them along to Danny, who's helping us today. And at the end, you'll also have an opportunity to get a free consultation to call me if you have some more questions that we don't answer today. So today's topic is, have you been told that you need knee replacement, injections, medication? Anybody been told that? Any of those things? What have they told you? What do you need? You've had a knee replacement. Okay. How long ago?
5 years ago.
Okay. How's it doing? So. Okay. I'm going to talk a little bit about that because I've had patients who've had replacements, had good success, and some people don't. So, surgery is something that you have to think over very, very carefully. It should be a last resort, not a first resort. And there are things that you can do even if you've had a surgery, and things that can do to help the outcome of that, and also to prevent it from being necessary. So we'll talk about that. Have you had injections, either of you? Yeah, before the knee replacement. Cortisone or gel injections? Both. Medications? Anti-inflammatory. Okay, so we'll talk a little bit about that, and I'm going to teach you some things that I've learned in my 40 years of practice and working with thousands of patients, is that there are alternatives to those three things too. And I try to incorporate as many things into my care as necessary, but some of them are not what you would get at a traditional doctor's office or physical therapy office, but they're very, very helpful and effective. So I've helped my patients with knee pain, arthritis, and post-surgical knee pain, limiting their need for medication and surgery, utilizing gentle exercise, weight management, posture adjustments, anti-inflammatory lifestyle changes, hands-on pain reduction, self-care strategies, and more. So that's what we're going to talk about here. You're in the right place if you want to hear that stuff. Now, need this to work though. Got it. Okay, you've heard enough about me. We're going to skip that slide. And this is my associate, Dr. Rockenow. She's a medical doctor who also has experience in care in areas of physical medicine, anti-aging medicine, natural solutions to pain, and female hormonal problems, nutritional counseling, and wellness care. And she is not in my office full time, but she consults and visits our office periodically. I'm going to read a mission statement that our office created I think now about 30 years ago. We haven't had to change any words in it because we still live by this mission statement. It's really what I think has kept our practice really on the right track, helping people for the right reasons. And so I'm going to read it to you. We're a unique multidisciplinary team of professionals dedicated to providing high quality, effective treatment to reduce pain and suffering in a caring atmosphere. Our goal is to educate our patients, their families, and our community. And it's part of the reason I do community talks like this is really, I want to educate not just my patients, but anybody who lives in an area who really, really might benefit from what we do. On how to sustain a lifetime of optimal health and wellness while limiting the need for drugs and surgery. And I always ask any group that I talk to, what words in here, even if it's one word or 2 words or 3 words, are the most important to you? And any answer that you give me is right, and you get a prize if you just answer anything. So no downside. Reducing pain, really, really a good thought. And I'm going to give you a little pain relieving gel. Okay, I don't know if you've ever heard of it. It's called, yeah, I like it a lot. It's one of my favorite gels that I think has no side effects. It's really a natural anti-inflammatory and something that you could use without any downside to it. Try it. It's not to say it's going to cure your problem, but it's a good relief for when you need it. What's that? It's a temporary solution. Yeah, putting anything on the skin is not going to solve a chronic knee problem, but it does make you feel a little bit better. And you're not putting something into your system. It's on the skin. It really has no downside. And it really is based on lots of natural products in it. It's not really a medication. So it's not a prescription medication, and there's no side effects. You want a prize too? Yeah, so that's,
A lot of times people have side effects. My kids sometimes listen to it and they're like, well, I can't cope with that.
yeah. If you listen carefully, they try not to make it too loud, and they try talking fast enough that you don't really pay attention to all of it. But every medication has side effects, and I've dedicated 40 years of my practice to finding alternatives to medication and surgery. Well, medication is something, again, I'm going to show you a little ladder, how you should really approach problems, where you start, maybe what's next, what's kind of the top step. So medication, limiting the need for medication. I'll tell you a little story. I've worked with probably a half a dozen doctors, medical doctors in my office, working for me, with me. One was an internist, and he came from a practice that had 9 other internists in it. And he said, after being in my practice for about 2 years, stopped me in the hallway, said, "Hey, Ed, I just wanted to tell you this. I've been here for about 2 years, and I now prescribe about 1/10 of the medication that I used to prescribe for the same problems that I prescribed 10 times as much medication when I practiced with 9 other doctors that practice like me." Why is that? I'm gonna give you my answer. One is, first of all, that's what they're trained to do. That's their primary training. That's number one. Number two is they don't have alternatives to medication surgery. So he didn't know much about nutrition, didn't know much about exercise, didn't know much about chiropractic, about massage, about acupuncture, about all the things that we were using to help people. He didn't know they worked. He had no idea. And they don't teach them that. It's not part of their regular training. And I'm not saying that I help everybody, but we help such a high percentage without medication and surgery that it should be part of everybody's awareness that it's possible. It's things that are possible that your doctor may not have told you, and it's not because they don't know, it's just not part of their training. That's not their expertise. Sure, anything.
My mom is back to Europe.
Mhm.
And sometimes she comes to me, her medicine, I ask her a lot of stuff.
Yeah.
Oh, my doctor told me about the red rice.
Yeast, red rice yeast for cholesterol. Yeah,
Go on the cholesterol.
right.
Doctor, recommended it's covered by the store.
Yeah. So that's another example of even our country is very, very closed-minded about other things besides medication and surgery. And you see how much advertising and marketing there is. Pharmaceutical company really, really controls a tremendous amount of medical training here and art marketing. And so I think that, yeah, they work together a little bit, and even the food industry is involved to some extent. They're not really trying to make it healthier either. They really, really are driven by economics. And, if something is profitable, they're going to push it. It's not really, and even whatever it says on the labels of some foods, you should really beware. Things that it says on the labels are things that you should ignore most of the time. And you have to find out what's right and what's wrong and what's true and what's not true from an expert, somebody who really deals with helping people with food and with non-medicinal types of treatments. And even the doctor won't give you perhaps the correct answer. So, but, everybody needs a primary care doctor, I believe. I'm not substituting for that. I'm in addition to really to give you an alternative. Okay, so everybody, I hope filled out one of these health, pain, and stress surveys. I ask a question about this also. How many people checked off one thing on that survey? At least one. Okay. How many people checked off 2 or more? 2 or more. How many people checked off 3 or more? So my point is with this is that these problems are common, but they're not normal. It's not like you're supposed to have them. And the thing that I'm going to tell you too is that taking a medication for each one of these problems is not the only solution. You want to get rid of the cause of the problem, not necessarily cover it up. So think about what you're doing for your health and maybe some of these problems. Are you covering something up or are you really getting rid of the cause? One way you can kind of think about it, either one of you have headaches sometimes. Let's think about that. Frequently? Yes?
I have.
Oh, okay. Well, those are a little bit unique. Are you on a medication for that? Yeah? And do they get triggered by anything in particular? Pressure does it. Hmm. So that really triggers them. Those are a little bit unique and sometimes they require a unique solution too. But let's say we take the average headache, the common tension headache, call it, and most people take something for that, at least sometimes, Advil, Tylenol or something like that. So I tell patients that you didn't get a headache because you had a deficiency of Advil or Tylenol. So it wasn't because you didn't have enough Advil or Tylenol in your bloodstream, and that's why you got the headache. And most people agree with that. So you want to get rid of the cause. Now, for a tension headache, I can relieve those usually with my hands and help somebody take some of the pressure off of the nerves that are causing the headache. And they don't need to put something into their body and they're not aware. And then I might even teach them the points to use acupuncture wise to try and prevent that. Sometimes it's a food that they eat that they're sensitive to that can cause a headache. Sometimes it's low blood sugar, but you want to get rid of the cause. My point, that's my point with anything. With anything, but dehydration is a common one too. So there are many causes. You want to not take the same drug, even though there's lots of causes. You want to get rid of the cause of your particular problem, no matter what it is. Yeah, usually it can help because these muscles tighten up, put pressure on nerves and blood vessels, and it can be part of the reason you get a headache. Usually for this to help, you'll have pain in that area. It's a temporalis muscle that gets tight. Sometimes it's this area that you get the headache. It might not help very much. So you have to get rid of the area that's causing the headache. Sometimes this area on your sides of your head is caused by jaw problems also. The jaw can have a dysfunction in it, and these muscles get tighter, clenched because of that. But anyway, let's talk about, compare your body to a car. So would you check your car if the engine light went on? Symptoms are a warning that something's wrong. There's no such thing as a normal symptom. You'd check your car to make sure it didn't get worse. So most people take their car to a dealer or a mechanic and, find out what's wrong. They don't, if the engine light goes on, they don't cover it up with tape, right? Just put black tape over it and keep driving. It's not going to go away that way. And a lot of our healthcare, it does that. It covers something up till it stops working again. Then you put another patch on it, cover it up again. And so my practice has always been centered on getting rid of the cause. So today you have two choices regarding your health and regarding knee problems, including knee problems is how you should deal with this. Deal with them. You can do the same things you're currently doing, getting the same results, or you can try something new, do something different, and get a different result. It's up to you. And so I'm going to show you some things that maybe you'll say, hey, that sounds like reasonable and good idea, and it may stop your need for more surgery, or it'll stop your need for decreasing your pain with medication, reduce your need for medication, doing something safe, effective, natural, affordable. Would you do it if all of a sudden would you do it if I gave you some answers to some of the things that weren't related to medication or surgery? You're open-minded to it, keep that in mind, and then maybe you'll learn more as we go along. What is functional medicine? Has anybody ever heard of that? Okay, it's a term that I think is going, well, it's become more popular, but what it means is making people function better. It's not a matter of covering up. It's a matter of making your body work better. And so functional medicine doctors' approach is to identify and address the cause of any disease or symptom. The body can heal and defend itself against all kinds of problems. Functional medicine is the science of creating health. Traditional medicine is the science of treating disease. So in other words, they find a disease, they write your prescription, or they prescribe some sort of procedure or surgery, but it's not really going to make you healthier. It really just kind of gets rid of that problem, and maybe your body still has lots of problems besides that. Side effect of creating health is it decreases and prevents other diseases and pains. So discovering why, not what. Traditional medicine spends its time, call it up in the leaves. This is it. So in the tree, there's leaves, and all of these problems, including chronic pain, knee problem, are up in there, and focus on each one of those particular symptoms, when really what we should do is that most doctors spend their time up here when they really should be focusing in the roots, okay? Even for knee problems. The state of American health isn't that good. You know, by comparison, we spend more money on our health than any other country by a long shot. And our life expectancy is 41st in the world. 40 other countries live longer than us. And it's not because we don't have the best doctors or the best medications or the best surgeries. I think it's because of the approach that we use. We're living a shorter lifespan for the first time. Our longevity is 26th in the world. Lifestyle, stress, and diet related. Our healthcare is the most expensive. More medication is prescribed and surgery done than ever before. And disease care is not health care. It's really disease care. We have increased number of sleep disorder. We have the highest number of obese and overweight people in the world. In 20 years, 1/3 of our population will be diabetic. And no matter how much medication we give those people, it's going to increase. Type 2 diabetes has increased by 30% in the last 10 years. And it's also increased in our children, younger and younger people, because we haven't got rid of the cause. They're still eating a certain way. They're not exercising. They're not taking care of themselves. Until we do that, this is going to be a greater and greater epidemic, causing more and more health problems. Alzheimer's, the 6th leading cause of death, is increasing. And we're calling that type 3 diabetes because it's somewhat related to elevated blood sugar. People who are diabetic have 4 times the chance of getting Alzheimer's or not. Connected, diet connected. And we haven't found any kind of a medication solution. And we're not going to. The reason I say that is because it's not one particular problem. It's a combination of problems causing it. Medicare, you know, people are covered by Medicare and they say, oh, well, I've got insurance for my problems. And the problem with Medicare is that Medicare has a standard. It says that care that seeks to prevent and promote health and prolong and enhance the quality of life is not considered medically necessary. So they're not promoting prevention. They're not paying for prevention the way they should. And that's part of the reason that the health of our country is going downhill instead of uphill. We have ways to make care affordable at my office, even for patients who have limited incomes and disabilities. So I try to make it affordable, even if their coverage is not that great. Don't let that stop you. So what can you do to reduce or eliminate pain? I want you to start thinking about what you can do that's under your control. There are things that you can do that are under your control. You can actually get involved and control reducing pain by knowing the strategies that are available. So we're going to talk about that. We talked a little bit about what things you've tried already, but these are the things that I use in my office. Maybe not everything on every patient, but these are some of the things that I have. This is my tool bag for pain especially. So pain reduction techniques, something called infrared therapy, which helps healing, speed up healing, acupuncture, another thousands and thousand-year-old treatment for helping people get healthier. Hands-on therapy, actually using my hands to decrease muscle tightness and exercise an area. Decreasing excess weight is a tremendous influencer of health overall. It improves your health to get down to a more ideal weight, and it reduces your health if it's done. And it increases inflammation. And so inflammation is connected to almost every health problem we have. So dietary changes in the tool bag, stress reduction. Anybody here who has no stress in their life? I can't say I don't. So the only thing you can do is try and handle it better. You can't get rid of it, but if you balance stressful situations with healthy things, then your body doesn't break down from it. You actually balance out the stress. The more stress that you're under, the more healthy things you should do. And most people, when they're under more stress, what do? Eat junk. There you go. One of the number one. Drink more, eat more, sleep less, worry more, exercise less. They do all the things that really should, they don't do all the things they should be doing when they're under more stress. And so I teach people that too. Have to balance out stress because stress can cause lots of problems. I'll talk to you about that too. Improving sleep, personalized exercise, discovering the root causes of pain. And there's something specific for musculoskeletal problems like knee problems. There are now brain-centered therapies. So instead of just treating the knee, we start to get you to actually make your brain work better to help the knee pain. We have to actually help your eyes work better to make you more secure when you're walking around, not aggravating the problem. And also when your brain doesn't have good vision, you don't have good vision, your brain senses that, then you are kind of always being protected by your brain, sending out pain messages so things don't get worse. Does that make sense to you? Think about it. And let's say you are, and I'll tell you how we even measure a little bit of how vision can be improved pretty quickly. Is if your two eyes are not working coordinated perfectly, and whenever you're walking around, your brain is sensing that. And maybe one side of your one eye is working a little bit differently than the other. And because of that, you never are as secure in your gait and in your balance and all of that. And your body actually says, hey, I better stick some pain into this equation, and then he will not do as much to hurt himself. It's a protective mechanism. And there are things that just aren't done routinely, even in a physical therapy office or in a doctor's office. Okay. Dietary changes to decrease pain and improve energy. Well, food can be your best friend or your worst enemy. So up here, people are eating nice, colorful fruits and vegetables, and they look pretty healthy. And down here, these two people had some pizza and a beer. So there's a difference. What you put into your body has a great, great effect on how you feel, how you look, how you perform, how much energy you have, what diseases you get. It is one of the most powerful medicines that there are, if not the most powerful. Food is medicine if it's used properly. Food can be your worst enemy or your best friend. And you're doing it every day, putting things into your system that can either be an enemy or a friend. I teach people which ones are the enemies and which ones are the friends. You increase the friends, decrease the enemies, miraculous things don't happen for people's health overall. Poor diet and nutrition factors can adversely affect pain, inflammation, and many health problems, including the worst ones that we have in our country and in the world: chronic pain, heart disease, diabetes, obesity, high blood pressure, stroke, osteoporosis, sleep problems, and cancers. So food can be our best medicine or our worst enemy. And instead of treating each one of these things, in Europe, they're giving people red rice yeast instead of a medication for cholesterol. And there's some other, many alternatives to medication. And so instead of treating each one of these things, why don't we fix the diet causes all of these things, and then we get rid of all of them instead of treating each one? Does that make sense to you? Maybe, and if it doesn't, I want to know about it. Does it sound like it made sense to you? Yes? Okay. It's almost too hard to believe, but this is something that was put out about 40 years ago in Time magazine, pretty famous, periodical. And what they said was the secret killer is inflammation. Inflammation really, really, again, you can pour oil on your body or you can pour water on your body to inflame. And there are certain foods that are like pouring oil on the fire. There are certain foods that are like pouring water on the fire. And you'll be amazed at how much of those you eat on a regular basis, most people in our country. So, quick guide to the anti-inflammatory lifestyle: active daily. So exercise is really important too. Doesn't mean you have to be a marathoner, but you have to do something. You have to move a little bit. You can't just be sitting around doing nothing and expect to feel as good as possible. It's just not, it doesn't make sense. Managing your weight, managing your stress, and even mental attitude has a lot to do with your health. So being optimistic, being grateful, smiling more, and eating a colorful, well-balanced diet, spending time doing things that you love and with people that you love. Symptoms and signs that have commonly improved with anti-inflammatory lifestyle: decreasing pain, decreasing memory problems, decreasing fatigues, insomnia, depression or anxiety, GI upset, mood swings, acid reflux, weight changes, constipation, or diarrhea. Again, you could give people a prescription for each one of these, or you can do this. Start developing what I call it anti-inflammatory lifestyle is what I teach people. If you've got several of these symptoms, they all start to improve without any side effects. I don't have to whisper all the side effects of that anti-inflammatory lifestyle. Detox. We are in a society that we're exposed to a lot of poisons, quite frankly, in our diets, in the air we breathe, in the utensils we use, in the things we put on our skin, also in the self-care products, and they add up. So I many times for a week or two tell people we got to get off stuff, bad foods, bad things you're putting into your system, and within a week or two, 70% of their symptoms will go. They start to feel better because they are not overloading the system with toxic products, and it can affect your knee joint, affect your pain. There's a book written by a doctor who's a friend of mine. It's called Healing Arthritis Naturally. And anti-inflammatory diet is one of the things that's recommended tremendously. And what happens is, even if your knees are bone on bone, which maybe some of you have been told or heard that, it doesn't mean that they have to all be as painful as in everybody the same way. Depends what you do besides having bone on bone knee. So how you take care of yourself has a lot to do with how much pain you have on bone. And bone on bone doesn't mean you automatically have that. But almost everybody that comes to me after they've seen a knee surgeon, it seems like everybody's told that bone on bone will come back to me when it's a little bit worse, and it will be bone on bone, and then you'll need replacement. That's all they're told. That's not true. Doesn't necessarily mean that that's the only solution. Specific supplements. You asked me, or you told me that in Europe they do give people supplements, and I do also. But I'm going to tell you something else, that supplements are not a substitute for healthy eating for life. And it's not, I don't give people a specific recommendation, everybody the same recommendation. Depends on what their problem is, what their diet is like, what their life is like. But which ones? Quality is very important. You're going to Costco and CVS for your vitamins and supplements. Generally not a great idea. Made by good companies. They're made for marketing. And if you're seeing it on television, not a great idea. You need something that had being made by a reputable nutraceutical manufacturer, and what's in the supplement is on the label, and it's not anything that you're not going to be. And I only recommend supplements that I have success with. So these are all things that I use with patients. Helpful, and also I know the company that I'm buying it from. Yeah, that's a pretty good company. Yeah. Yeah, you really should know where you're buying your product. But I think everybody who isn't a nutritional expert needs an expert. So even the amount of the supplement is important, and not every Solgar product is ideal for every product. You need somebody who's going to advise you about it. So a doctor with experience using food as medicine is really going to make a big difference in the effectiveness of the supplements too. Don't guess. Sometimes we test for it. Sometimes we test to see if patients are deficient in certain things before we give them something too. Some of the supplements that are helpful for pain and general health, quality multivitamin, multimineral vitamin C is a very important supplement. Vitamin D3, 40% of the population is deficient in that. Omega-3 fatty acids have a very, very beneficial pain relieving effect and a very good effect for the brain in general. Quercetin is something that can be helpful for allergies and also for pain too. Probiotics, flavonoids. So these are just general things, but don't buy them. I tell you, don't write them down and buy them. You'll just be wasting your money. Better to get some advice about it. I just want to give people an example. Decreasing excess weight to decrease pain and so the benefits of losing weight: decreased inflammation and pain, decreased inflammatory hormones, increasing your energy, decrease cognitive decline, improving the ability to move and exercise. So there is no vitamin that does all of this. There's no medication that does all of this. So this is something that helps everything. Getting down to a more ideal weight is really, really important, and feeling good when you do it too. You actually should improve how you feel tremendously. I see a lot of patients for weight loss. So these are some of the ways that I help people with weight loss, and it's different for everybody. Has anybody tried losing weight by counting calories? Yeah. So that is a real myth that works. The reason is, first of all, it's very hard to be accurate, number one, and not all calories are created the same. I'll give you an example. Has anybody seen little packages of Oreo cookies and there are 100 calories? Has anybody seen that? And you say, oh, of cookies. Well, yeah, well, they advertise it, so on the package of this Oreo cookie, 100 calories, Oreo cookies. So somebody says, I think those are pretty good. They're only 100 calories. They're not the same as 100 calories of broccoli or spinach. It's not the same. It has a tremendously different effect on your metabolism. Your blood sugar goes up and down. You really, really use up so much more energy when you eat those Oreo cookies, and it causes more inflammation. So calories are not the key. Yeah, temporary, but it's a very poor source. A very poor source. Quality is the really, really important thing. And if you think about it, Oreo cookies don't grow on trees. So, and the reason they don't grow on trees is because they're made in a factory. And we've never been able to duplicate what grows on a tree in a factory. Never. So you want to get as close to, the source of the food rather than something that's been made in the factory. What's caused so many of our problems is because we eat a lot of processed foods. Yeah, it's a big deal. It really is a big deal. If you care about your health and you're really not happy with how good you feel now, you could feel better if you're eating significant processed foods. Anybody know a guy named Jack LaLanne? So he was around a while ago. Maybe you don't know. Okay, he was a very, very well-known trainer on television. He actually was a very fit guy and talked about food and exercise all the time. And he had a very simple saying. He said, if it's made in a plant, I don't eat it. If it's a plant, I'll eat it. So he tried to stay away from as much of that as he could. Lived to 96. He could pull a whole fleet full of boats with his teeth. He was just a phenomenal example of what healthy eating and healthy lifestyle could do. And I'm not saying we should create that for everybody. You want to live your life and enjoy your life, but a limit. When you start to get messages like those symptoms on that survey, then you should be thinking about what can I do about it to help those things. Posture. Posture is a big factor with everything also. There's nothing good about bad posture. And if you sit a lot during the day or you do a lot of bending and lifting, it can cause problems that even affect your whole bodies and knees especially too. So good posture is really important. And we start every person who comes into my office with a postural evaluation. Do a computerized picture of the posture, see how much weight they're carrying on one side versus the other. And we even do a scan of their feet to see how their feet are being, posture of their feet, how they're affecting their knees and their hips and their shoulders. And so if you've got a poor foundation, then you also have much more wear and tear on your body. You don't have a poor foundation. So to ideally help with pain and problems and energy, reduce or eliminate pain through drug-free physical treatment, treat the cause while limiting the need for medical surgery. This is the computerized postural picture that we take on patients. Anybody ever had acupuncture? You? So we do it in my office primarily with a little electrical current. And I gave you a handout on it. Looked into your handouts, there's something about it. Yeah, so this is a little electrical device that can be used to stimulate points on the ear and the body that will help knee pain. These points are very helpful for that. It's a technique of using points on the skin of the ear and also the rest of the body and it's referred to as auricular medicine. Practitioners from all over the world use this therapy to treat pain, addictions, and internal disorders. And this was discovered actually in France. The original Chinese acupuncture is Chinese, but in France, they started to discover how the ear really, really played a big role in that. Use it every day.
We don't do it all over the body.
Both. I use both.
Oh,
I use both. But I would say the ear points can be very powerful, where sometimes that's all that's necessary. And it's without piercing the skin, which is awesome. Okay, I'm going to show you something that I also do every day. It's called the Graston technique. It's a remarkable procedure that allows us to detect and treat areas of scar tissue. This has a lot to do with knee problems or adhesions in muscles. I recently got a patient who had a knee replacement. And after the knee replacement surgery, he really wasn't doing very well. They said it was scar tissue that was limiting his ability to heal entirely. He couldn't walk very well. And they even had to put him under anesthesia to try and break up the scar tissue. And it did it in such a painful way that he couldn't be awake. I use this technique with him. He's walking so much better. So scar tissue can be removed without a surgical procedure. It's a tremendous technique. And I was specially trained in it. And it's used, you might see it if you watch any sports, you'll see it used right on an athletic field also. You have, yeah, how did it go?
yeah, it was part
For-
of physical therapy.
For what?
For, I.
Yeah. Okay, it can be used for soft tissues anywhere. Really. Danny, why don't you play the little, I'm going to just give you a little short synopsis of the doctor. He's a teacher of Graston technique. Give you an idea of what it is. You've had it, so you know. You haven't, so you give you an idea. Yeah. It's only about 2 minutes long. But I think it tells you a lot. Little volume. Don't hear it, then I'll start talking. Okay, but I brought a couple of those tools with me, and they look maybe a little scary, but they're not. They really are used to almost rub the scar tissue out in different directions. And scar tissue, I gave you a little handout about it. Scar tissue is when you have an injury and it doesn't heal perfectly. No scar tissue is a perfect heal. It's the one way your body heals itself, but it never is exactly the way it was before. And this helps it come closer to the way it should be. Yeah, he talks about that too. Yeah, you have to glide over the skin, plus it can cause a little bit of irritation to the skin. Yeah, we lubricate it and but different tools for different parts of the body. The other thing that's unique about it is we can actually feel where the scar tissue is through the tool. So this is, they make special stainless steel, and the feeling, it gets transmitted to my fingers. Doing that. I've got pretty sensitive fingers. I call them X-ray fingers, so I can actually feel right through the tool where the grizzle is. It's like, like that. You buy a really good steak, there's not much grizzle in it. It's like filet mignon. But if you buy a cheap steak, you can taste and see the grizzle, and that's what scar tissue is. Oh, okay, that's all right. But that's the gist of it. The scar tissue can be reduced. It won't be perfect, but the pain will be tremendously reduced. Did it work well for your Achilles? Yeah. So, nothing's 100%. And that's why this is one tool that I use. I have one tool in the bag. Was it? Yeah, that's, so you're, and then it really wore.
Yeah.
Yeah. Still give you trouble? Yeah, well, again,
Better.
yeah, but that's one tool. I just wanted to let you know about that. It's a non-surgical tool that can help a lot, even after surgery. Okay, we'll move on. Okay, if I go through it? Yeah. Okay. So anybody ever been told they had a disc problem, herniated disc? No? It's another technique that's pretty specialized in that. But anyway, this is what you said, it seems like you go to the doctor, you get a prescription. And it doesn't take very long, writes a prescription, he puts a name on your condition, gives you a pill for it. So if you're frustrated by that, if you don't want to just have that as the only option, that's what I'm talking about today, that there are other options that he may never tell you about that really work well with outside effects. And the way to look at how should you proceed. So first of all, 42% of people that see a surgeon first have surgery. 1.5% of people that see a chiropractor first have surgery. Tremendous difference. So limit your need for medication and surgery, and these pain-reducing healthy strategies are what you should use first, then medication, then surgery. That's the ladder of how to treat yourself. Okay. Stress, we talked a little bit about that. It worsens pain and inflammation and picks on your weak spots. Stress causes weight gain. People who gain weight over a period of time after a stressful situation is very common. Because when you're under stress, your body says, oh, this is an emergency. I better store all the food that I'm getting because I don't know where my next meal is coming from. It's really, that's what your body is doing, protecting itself because it's a stressful situation. And when you're in a stressful situation, you really, really want to make sure you've got enough food for it to live, to survive. And so your body actually stores extra weight. Evolution. Yeah, that's part of why we survive. It's really that under stress, our body actually holds on to extra weight. Stress reduction techniques. I gave you one. It's called diaphragmatic breathing. You can just take a look at that, practice it, start using it when you're under stress instead of, if you're stuck in traffic and somebody cuts you off, it's like cursing right away. You might want to just take a few deep breaths and it really, really would help too. I can actually show you. I like to teach people something here today. So if you put your hand on your belly, okay, and just watch me. Okay, so this is when you're using your diaphragm to actually get air all the way down. And if you watch a baby breathe, their bellies go in and out. That's the way we're supposed to breathe. So I'm going to breathe in through my nose, and I'm going to count to 5 in my head. I'm going to hold it for 5, and then I'm going to blow out to 5. So it's, watch my belly. So my belly got bigger. Okay, here's my belly normally. I'm going to breathe in the right way, without lifting my chest up, without anything else. Breathe air all the way down. You're using my diaphragm. It stretches the nerve that goes from your brain to your diaphragm. It gets you to secrete chemicals that are relaxed. It's actually happening. Okay, I hold it for a count of 5, and then blow out pretty forcefully so my belly button goes back towards my spine. So try it. Take a deep breath in. Good. And make that belly expand. Hold it for 5. If you take 5 breaths like that 5 times a day, and if you happen to have a little bit of high blood pressure, you lower your blood pressure. Just doing that instead of maybe going on medication. So it's another alternative. Improve sleep positions and environment to decrease pain and improve energy. Sleep is really important. A lot of people don't really give sleep the credit it deserves. And it's when our bodies repair themselves. So true. And I usually use that word. And it should be what I call rejuvenating. It really, where you wake up in the morning and you don't need 3 cups of coffee to talk to somebody or to think, and you can kind of get out of bed pretty quickly. You don't hit the snooze alarm 6 times. Yes, quality sleep, absolutely true. There's a difference, but some people don't get enough even amount of sleep. It's really poor too. So position that you sleep in is really important. Either on your back with a little bit of support underneath your neck, or on your side so that your nose and your chest are lining up and you push one way or the other. Stomach sleeping is the least desirable. So how many people sleep on their back? How do you two get? Back, side, stomach? Any of you don't sleep? Don't sleep at all? Okay. So don't sleep is really not good either. So I'm going to tell you what it does. If there's anybody here who wants to age faster and recover slower from everything, they'll ignore sleep problem. And the answer to the sleep problem is not more red wine, more scotch, more Tylenol PM, more Ambien, more Lunesta. Those are not going to get rid of the cause of sleep. It's a combination that really causes it. Stress is one of the big factors. Diet is another factor. Weight is another factor that affects sleep tremendously. And if we get rid of those, then you don't need those other things covering. So you want to try and get rid of it naturally. Help the sleep naturally. You'll live longer and also have less inflammation. You'll have more energy. Your brain will repair itself more easily. It just does so many things that are good. Have quality sleep. Regular exercise. Again, I'm not trying to turn people into marathoners. I want them to do something. Something is better than nothing, and something that isn't going to hurt them too. For knee problems, you have to really give people certain exercises that are good for them and nothing that's going to aggravate them too. And there are exercises that are especially good for knee problems. Exercise, a vital part of any knee pain and stress management program. It's a combination of exercise that improves strength, function, flexibility, stamina. You need expert advice, and there are things that your brain does to help exercise work better. And I said your vision can be a big factor also. So I want you to test on it. Every YouTube. Take your thumb, put it way out in front of you, but line yourself up nicely so that you're looking straight ahead and your thumb and your nose line up. Okay, so your nose is right there. And I want you to, don't do it yet. You're going to bring your thumb slowly right at your nose. And if you start to see two thumbs instead of one, that's a problem. So if you start to see two thumbs, go slow, right at your nose. Blurring is okay, but two thumbs is not okay. Anybody see two thumbs? Nope. Nope. Good. Anybody? Okay, and then you can go away also. And go away, make sure you don't see two thumbs that way either. Two thumbs tells you that your eyes are not coordinated. There are other exercises that test your peripheral vision, below, to the sides. We need that too, testing. And we teach you exercises to help with that if there are problems. And that helps with knee pain too.
My doctor does that.
Yeah, that's different. That's just to test the muscles in your eye and to see that they're going in all the right directions on this. That's a little bit different. That's part of an eye exam, but this is a brain eye exam. Yeah, that's a screening test to make sure you have nothing that's wrong neurologically with the eyes. That's more serious. Okay, but this is for balance, for helping your body coordinate your movement with your brain and decreasing pain. It actually decreases pain. I do it before and after. Because let's say somebody comes in and their knees are really hurting, and I put them through a couple of tests visually, a couple of tests balance-wise, and they test before and they test after. Almost all the time, it makes a difference immediately, where they're actually walking better, or they can actually have a little more flexibility right away. It really makes a difference.
Right. Balance, right.
Well, that's one of the parts. Then there are also movement parts also, having you move. So there's another slide that we'll talk about. So here's one about the stages of osteoarthritis. And all I want to say about this is that This is fairly normal. You see a space between the bones. Everybody see that? So that's stage one, mild. Okay, this is moderate. It's a little bit less space, but again, not something that really the doctor would say, oh, a surgeon wouldn't say, oh, you need surgery. This is getting a little more severe, closed on one side. This is where it's pretty severe when the bones are together. But even the way the X-ray looks does not dictate how I treat someone. The X-ray is one part of the equation. The X-ray has to match the patient. In other words, you have some people who have really, really bad X-rays for all sorts of problems, all sorts of parts of their body. Your knee can be bone on bone. One person will have severe, severe pain, no matter what they do. Some people have bone on bone, have mild to moderate pain. Some people, it can be changed depending upon us. It doesn't mean there's nothing that can be done. I'm a very, very good example of bone on bone. I've had several knee injuries when I was in my late teens, early 20s, two meniscal surgeries during that. And most of the cartilage was removed. And so I'm 70 now and really I've been bone on bone for about 12 years. I still function, I hike, never with doing the things that I'm talking about. I eat an anti-inflammatory diet, do the exercises that I'm talking about today, and therapies that I talk about. Well, weight makes a difference too. So it's a combination. That's really what I'm trying to teach you, that it isn't just one solution. You want to get rid of as many of the causes of the problem, and the combination is what works the best. Yeah, I mean, I'll tell you, I see a lot of people with back degeneration and arthritic changes. 30% of people are walking around with herniated discs and they don't. So the picture is one part of the diagnosis. Picture and the patient have to match. So you have 30% of people with herniated discs, they don't even know it, so they don't need surgery. If we looked at their MRI and we didn't have the patient there, you need surgery. You've got a herniated disc. Well, everybody who treats just the bone on bone says you need surgery. Well, I'm a living example. 40 years ago, I was heavier, never super heavy, but probably about 25. And then in my 20s is when I lost weight, and I have been on a lifestyle diet that I don't gain. I don't run or jog, I bike, I swim, golf, I hike. Those are the things that I do. Okay, so you could think about what have the knee problems prevented you from doing. So tell me, what's the knee problem stopped you from doing? You like to hike, and so you haven't been able to do that as much as you'd want to. Stops you.
I'm on my feet all day at work.
Okay. Oh, okay.
Okay.
Yeah.
And building.
Mhm.
So, yeah.
That doesn't help.
Certainly when I'm on a walk, sometimes it's like.
So I would say you're a candidate for what I'm talking about. So it's not an emergency. You don't have an emergency surgery situation, but you want to function better. That's what I work. Help people. And now the other one's starting to get wonky. Yeah. Again, the X-ray is one part of the diagnosis. How you function is another, and whether you can be helped is another. So I have patients come to me. I say, I can't help you. You're beyond the point where I can help them. And so, but if I can see that they can improve just with some of the testing that I do when they come into the office, you're a really good candidate for not doing surgery then. Wait with it, and there's really, really room for improvement. So how do you feel the fact that you can't hike? Does it make it?
That's one of the ways I stress.
Mhm. Yeah, that's a great way.
For a while.
Yeah. Yeah, that's a great way to relieve stress. So, and that's important. It helps your health in a lot of different ways, and to be limited like that, not good for you. Yes. Yeah. So that's where you get some trouble too. So these are the new types of rehab and exercises reducing arthritic pain, which is what's going on in the knee. It's called osteoarthritis. It's wear and tear. And we can limit your medication surgery. And I said, brain-based training. It's new and effective. It removes the cause. It doesn't, and we don't even treat the knee many times. The joint above and below your knee is really, really important. Your hip and your ankles really take part of the punishment and give part of the punishment to the knee. So it's, I don't just focus on the knee, but I focus on your whole body is really the way I look at it. And an anti-inflammatory diet is something that really takes into consideration your whole diet, your whole body, and weight loss also. And I think the longer you procrastinate, generally the more difficult it is to fix. So the sooner that you do something that really you could be doing is helpful. And you don't have to jump to medication surgery. There's another level below it. So the reason many good approaches fail is simply because they're incomplete. What I mean by that, just like a puzzle, if you don't get rid of, you don't find all the pieces in the puzzle, one the puzzle piece is missing. If you're still eating badly, if you're still not the right kinds of exercises, if you're not lined up properly, then part of the puzzle is missing. Never going to feel as good as you can. We have to fill all of the puzzle pieces. So we don't just treat the knee joint, we treat above and below. We even treat the brain and visual system, treat the whole person. Different than what you do when you go to a specialist who looks at that and really doesn't pay much attention to other parts. They're all connected. So this is what I call our Restore Your Knee Health Program. It's talk about nutrition, we talk about specific supplements, we talk about stress reduction techniques, we teach you about specific exercises, specific lab testing, sometimes necessary, and I give you access to my private email and phone line, and we have patient-specific and supervised weight loss. So you can have the best life you can have and really not go through some surgery again if you don't have to. And so we determine the underlying cause, create a unique plan, educate you, empower you, guide you through it, hold you accountable, encourage you, celebrate when you feel better. It's a nice process. Education alone is powerful, so that's what I'm doing tonight, this afternoon, is really educating you. But if you want the benefit of what I'm telling you, you've got to take some action. Just sitting here and going home and doing the same things doesn't do very much. You got to do something. You got to do something different to get a different result. So fixing your health problems yourself after today, it's like trying to fly a plane after listening to a lecture. So it's not the same as learning how to fly it. And you need some expertise. Anybody know who Michael Jordan was? Okay, Michael Jordan. I love basketball. There's, most people will say he's at least one of the greatest basketball players ever. And he came out of college. He was pretty good. He was very good, but he never won a championship until he had a great coach. Coach made a big difference for him. All of a sudden, he won 6 championships until Jackson became. But coaching is very important in sports, and it's very important in taking care of patients. What? As a coach? Yeah. Teams, yeah. He was the coach of Charlotte. Yeah, absolutely. So very helpful to have the right coach. So if before you leave today, we give people an opportunity to find out more. And all it means is that I would talk to you on the phone for free, no charge, talk to you a little bit more about what you've done, what you've tried, what worked, what didn't work. And just from listening to you for a while, and listening to me, I really can determine whether I think you're a good fit or not. If you're not, I'll tell you. I don't want to treat people who are not a good fit. I want results. I want people who say, go out and say, God, I'm glad I saw Dr. Markowitz. Really, I thought I did everything. But when you have 44 years experience, you really have a lot of chances to try tremendous number of things. And I always am trying to be an expert in how to do things without medication. Certainly, that's my expertise. So if you'd like to do that, You could talk to Leah before you leave, and there's a, should give you an envelope, has some questionnaire in it, gives me a little bit more about your health in general. And she'll set up a time. She's going to give you a call and talk to you on the phone. No obligation, doesn't cost anything. This helps me weed out the people that I don't think I can help and weed in the people that I think I can. And for anybody on Zoom, would like to schedule a free phone consultation, just call 203-798-WELL. We'll do the same thing for you. May have some problems that we could help also find out over the phone. And then if it's a good fit, then I tell you what to do next. You decide if you'd like to do that or not. Then we do an exam in the office. So and this is a pass for anybody you know, or somebody else who's got a health problem or knee problem in particular. I'll give you one of those if you'd like to have one of those, and they get a free phone call also. So I'd be glad to do that for that. A comprehensive 1-hour consultation evaluation. If after the phone call, we both agree that I could at least look at you and help you further. Costs $95 for that. It's normally $395. Lecture, and you learn something already. I'll talk to you about everything in that 1-hour consultation, and you fill out this form before you have it. So that saves a little time. But normally that's a very comprehensive consultation. We review all of your past imaging and testing. We screen test you for stress. We do a postural evaluation. We do a computerized foot scan. We test for undetected nerve problems. We do a diet diary review and measure your percentage of body fat and tell you how much weight you should lose. And you can decide whether you want to lose that much or not, but it tells you how much extra weight you're carrying around. And some people don't want to lose that much weight. Some people say, hey, that's just right. But fat is what you want to get rid of. You don't want to get rid of muscle, get rid of fat. And fat is what causes inflammation. When you get rid of the inflammation, you feel better all over. And we do a plan, give you a plan on how to fix whatever you're concerned about. And you know what the cost is before you do anything. It's first a phone call. If that's amenable to you, that you say, hey, what Mark talked about over the phone sounds reasonable for me to do, then you can make a consultation visit for $95. That's up to you, but the phone call is free. You have nothing to lose there. Yeah.
This consultation.
It may, if for a knee problem, it may be, but we would check on that. But I would say, I wouldn't count on it. I can't guarantee that. Yeah, we check on it.
Is your visits on a regular basis covered?
It depends what the problem is. We check on that. So I would say for some problems, yes. Mostly for physical problems, yes. For overall health problems, preventive health, if something else is an issue for you, we try to get you covered. We check on it. I have somebody who works for me who was in the insurance business before she started with me. She's worked for me for 40 years. She's an expert. So we try to help you. Yeah. Some of them, right? We have to check on it. We have to check on it. And so before you do anything, except for that $95, I can't guarantee that we would ask you to pay up front because we check on it. And I'm going to set aside an hour to talk to you for $95. And so I can't really wait 3 months to find out whether the insurance company is going to cover it. And I don't think you should want to wait either. Yeah, no, it's a good question. And I understand it. Yeah, no, I understand. The thing is, think about what your insurance company has done for you. I mean, if you had things checked off on that health survey, and you really haven't gotten all those answers yet, maybe you have to go outside of what insurance companies are paying for. But I don't know that. Some, and they define it though, fortunately, it's their definition. So anyway, that's another story. But the initial obligation is nothing for the application on the phone, and then you decide whether you want. So I thank you for being here. I'll stick around a while if you have some questions personally, and love to talk to you online. Okay, thank you.